What is Alzheimer disease? Alzheimer disease that rob people of their memory. At the past have a hard time remembering recent events. They thought that they might easily recall things that happened years ago. As time goes on, other symptoms can appear, including trouble focusing, a hard time doing ordinary activities, feeling confused or frustrated, especially at night, dramatic mood swing, outbursts of anger, anxiety, and depression, feeling disorientated and getting lost easily. Physical problems such as an odd walk or poor coordination, trouble communicating. People with Alzheimer's disease might forget their loved one. They might forget how to dress themselves, feed themselves, and use the toilet. The disease may bring tissue breakdown over the time. It usually happens to people over the age of 65 years. A person can live with Alzheimer's disease for just few years or a few decades. More often, however, people live with it just for about 9 years. About 1 in 8 of, of the people at the age of 65 years and over has the disease. Women are most likely to have it than men. What are the causes of Alzheimer's disease? People who get Alzheimer's disease are usually older because the disease is normal part of the aging. Scientists aren't sure why some people get it and others don't, but they do know that the symptom it causes seem to come from two main type of nerve damage. Nerve cell get tangles called neurofibrillary tangles. Protein deposit called beta amyloid plaque build up in the brain. Researchers aren't sure what causes this damage or how it's happened, but it could be with a protein in the blood called apoprotein, which the body uses to move cholesterol in the blood. There are few types of APOE that may be linked to a higher risk of Alzheimer's disease. It could be that certain form of it causes brain damage. Some scientists think it play a role in building the plaque in the brain of the people with Alzheimer's disease. What are the different types of Alzheimer's disease? Nearly everyone with Alzheimer's disease will eventually have the same symptom: memory loss, confusion, trouble with one's familiar task, making a decision. Though the effect of the disease are similar, there are two types. Number one, early onset Alzheimer. This type happens to the people who are younger than 65 years old. Often they are in their 40s or 50s when they are diagnosed with the disease. It is rare. Up to 5% of all people with Alzheimer's disease have early onset. People with the Down syndrome have a higher risk of it. Late onset Alzheimer's disease. This is the most common form of the disease which happens to the people at the age of 65 and older. It may or may not run in a family. So far, researchers haven't found a particular gene that causes it. No one knows for sure why some people get it and others don't. Familial Alzheimer's disease is a form of Alzheimer's disease that doctor knows for certain is linked to a gene in a familial that are affected member of at least two generations that have the disease. Familial Alzheimer's disease make up to less than 1% of the all cases of the Alzheimer's disease. Most people who uh, have early onset of Alzheimer's disease have familial Alzheimer's disease. What are the diagnosis and treatment? There are no cure for Alzheimer's disease, but medications, sensory therapy, more can help its symptom. And to get the full benefit of the treatment, earlier diagnosis is important. Learn more about Alzheimer's diagnosis and treatment. Today, there is no cure for Alzheimer's disease. Researchers are still trying to fully understand how the disease leads to the memory loss and other problems with thinking and behavior. They hope one day they will reverse those changes to prevent or stop the disease. But if you have a loved one had Alzheimer's disease, there are a treatment that can make a difference. Some therapies ease of the symptom and help the people do better for longer. Because of the disease affect the changes over time, people often need to have their treatment adjusted by the doctor, or they need to start new ones as different problem emerge. What are the medication? Different types of drug can use to treat the memory loss, behavioral changes, sleep problems, and other getting a lot worse for a few months or even a year. All of them can have a side effect which can be more of a problem for the older people. Doctor may recommend one or more type of medication depending upon a person's symptom. Some drugs treat problems with mood, depression, irritability. Those include citalopram, Celexa, fluoxetine, Prozac, paroxetine, Paxil, sertraline, Zoloft. For people who have anxiety or restless, medicines that can help include alprazolam, Xanax, buspirone, buspar, lorazepam, 81, oxazepam.